Hey, class, Ms. Chaudhry here with your notes on the 12-point physical exam. So, first of all, we want to start with what is a healthy animal. Hopefully, yesterday, as you watched the short video, you were able to identify some of the things that the vet and vet tech were mentioning as being important signs of a healthy animal. But some of the big things that we look for are clear, bright eyes with pink membranes around the eyes. Obviously, that might be different if you have an animal that has a different colored skin. There are certain breeds of dogs, horses, etc., that don't have pink membranes, they have black membranes. But generally speaking, you want pink membranes and then clear, bright eyes. Focused, attentive. Appearing content, like animals that just appear happy and calm, comfortable in their situations, but at the same time are also alert and interested in their surroundings. They're not just kind of like laying back there, not paying attention to anything. They know what's going on around them, but they're also happy and safe in that environment. Good appetite is really a good indication of health. An animal that's eating normally isn't ignoring their food where they would usually be eating excitedly, that they're consuming water as well. Um, Also a good sign. Sleek, shiny coat with hair that's pliable, not dry and brittle. We talk throughout our animal science courses about how coat is a really good indication of health because that's one of the first things that stops getting nutrients, stops getting well taken care of, either like by the actual nutrients within the animal's body, but also animals that aren't feeling well stop taking care of themselves until they'll stop engaging in normal grooming behaviors. So, coat is a really good indication that something might be wrong with your animal. Looking at their feces and urine, making sure that they look normal in appearance, but also that they're going regularly. This is much easier to do for something like cats, where you're cleaning their litter box and you're noticing some of those things as you clean, and you know how full it usually is for however long you go in between cleaning them. But other animals too, if you suspect that there's something wrong, checking their feces, checking their urine, noticing how often they're going out to the bathroom, things like that are going to be helpful. In some cases, you'll notice that they're going too much, which can be an indication of poor health. In some cases, they're not going enough, and that's also going to indicate that there's poor health. And then their temperature, pulse, and respiration, which we'll talk about a little bit more in depth later, are also in normal range for their species and also for that individual animal. So those are all some general signs that we look for that kind of indicate, hey, this animal is healthy. But as we go through our 12-point physical exam, there's going to be a lot of other things we look at as well. So get started with that. So the 12-point physical exam is important because it accounts for all of the major areas of an animal's body. Okay, you want to make sure that you're looking at everything. It's really easy with health to overlook something small when you're going through quickly or not thinking about what are all the things I need to check off this list. Because sometimes what's going wrong with an animal's health is really small. And it's not something that you might see a lot of evidence for that might even cause the animal to act or look different. 12-point physical exams are also very thorough and they are qualitative as well as quantitative. What that means is we're not just looking at like numbers, like how many times is its heart beating, how many breaths is it taking, but we're looking at the characteristics of those things, like is its coat nice and smooth? Does it feel rough? Is this animal's breathing sounding shallow? Okay, we're looking for descriptions as well as numbers. So, the very first thing that we do to examine an animal's health or to do an exam is look at their overall appearance. Okay, just like our signs for whether or not an animal's healthy kind of give you that overview, this is giving you an overview. It lets you see a lot of those things. Does it act healthy? Are its eyes nice and bright? Is its coat shiny? Does it look too fat or too thin? You guys will do an activity with little body scoring next week that will kind of look at some of that overall appearance as well. You can see here we've got two pictures of very different horses, one of which looks pretty healthy, at least based on general appearance, and one that definitely doesn't. Okay. Then we want to make sure we look at the integumentary system, all of the skin. Um, Again, we've kind of talked about coat already, but looking for those coat characteristics and also feeling the animal along its skin. You saw that in the exam that you watched. Okay? Feeling for any any rashes, any flaking skin, anything that looks unusual or out of the ordinary, any excess shedding that might be not seasonal. Obviously, this time of year, there are a lot of animals that are shedding because that's blowing out, losing their winter coats. But just kind of being mindful of some of those things. Some animals have allergies, and so some rashes might be normal. You guys know when Moose comes and visits, he's usually got a red stomach. He's got a lot of allergies. So you want to be looking for those things. We also want to look at the musculoskeletal system. The vet that we watched was doing something called palpations, where she was actually like feeling the underlying muscle tissue, trying to see if anything was warm or swollen. She was also like looking along the spine to see if there was any pain or stiffness, checking to see if there's anything when she watched movement to see if the animal was moving strangely, might be favoring a limb, walking with a hitch in their gait, something like that, that's going to say, hey, something's wrong with one of these two systems. And these are really intertwined because obviously the muscles are what allow the skeletal bones to move. So they kind of go hand in hand with one another. I should also note that as we go through this, this is not necessarily the order in which a vet is going to do their exam. These are just all of the different things that they're looking for. Typically speaking, most vets will take a head to tail approach. And so they're going to be looking at all of these things throughout all parts of the body as they move from the front to the back. And that helps them to make sure that they don't miss things. Circulatory system, things we're looking at are things like fainting, dyspnea, which is difficulty breathing, which might sound like it's a respiratory issue, but can also be related to the circulatory system because, in a lot of cases, some of the things that will cause difficulty breathing in animals can be things like fluid buildup around the heart. So that can actually indicate a circulatory problem rather than a respiratory, or I should say one that's causing also a respiratory problem. We also want to listen for things like heart murmurs and watch for things like stumbling and dizzy spells, which are going to indicate that there's an issue with the circulatory system getting oxygen to the right parts of the body, specifically the brain and then potentially the muscles as well, so that that animal can move appropriately. And just like we talked about in our last unit, all of these things really are very connected in how they work together and help each other. So then respiratory would be next. In addition to some of the things that related to the circulatory system, we're also looking for things like coughing, sneezing, any discharge around the nose, which you can see this rabbit in this picture has a little bit of nasal discharge. Looking for the color of that nasal discharge, frequency of how much they're coughing and sneezing. Are they able to do what is considered a normal level of exercise and movement, or are they tiring kind of easily? We also look for something called cyanosis, which is literally means like condition of blue. But cyanosis basically means that we notice some of the tissues, particularly like the skin around the nose, the gums, the eyes, sometimes even like around the toes, etc. Anywhere where you can see exposed skin, is that turning blue. And that's going to indicate a lack of oxygen is getting to those more external structures, and that is a big like fix that now problem. Okay. We also want to look at their digestive system. So, in the signs of a healthy animal, we mentioned things like being able to go to the bathroom. That can really tie into the digestive system. Is the animal eating normally to get food to defecate or urinate out? Have their diets changed recently, like the actual things we're providing for them? Sometimes that can indicate some intestinal discomfort. But also, we want to think about, are there things that they could have gotten into? Antifreeze is the number one poison that affects dogs, especially, and also cats, because it's readily available in people's houses, or in their garages. Sometimes isn't like kept up away from animals. It can easily spill or drip out of a car, and it smells sweet to animals, so they're attracted to it. And so that is one of the number one poisonings for household pets is antifreeze poisoning. But rat poisoning can also be a big one. There's a lot more these days on the market, like pet friendly rat poisons that are at such a low concentration it won't bother your pets. But those are things to think about and be looking for signs of if they're vomiting, if they're experiencing diarrhea. All of those can kind of indicate that something is going on. And again, with animals, they can't tell us. So, as pet owners, we kind of have to be diligent and watch that because there are lots of different things that can cause something like vomiting and diarrhea. Okay, kind of like as we're talking about the coronavirus right now, we've also got the flu going around and colds and things like that. And so lots of symptoms can apply to lots of different problems. And so going through an exam and doing a full diagnosis, all of these different steps, processes help us to kind of eliminate, like, oh, yeah, we definitely see signs of more of this thing than that thing. Next, we look at the genitourinary system, so the kind of the reproductive system or genitals, and then which also work with the urinary system, as we know. Obviously, in doing a physical exam, we can only really see the external parts, but doing some of that muscle palpation, some of that feeling around can also help us to feel if maybe there's something swollen or warm inside. But big things that we're looking for here are, is that animal having any excess discharge? Is there any strange smell or color to any discharge in their urinary or genitals? Is anything swollen? Do we notice that animal's having a difficult time going to the bathroom, either urinating or defecating? Because the reproductive system and the urinary system are so intertwined with a lot of structures they share, having an issue with part of the reproductive system can actually affect how well or how easily that animal is able to go to the bathroom. In the picture we've got on this slide, we actually have a cow who was suffering from a prolapse. So in some cases, an animal can strain so hard to either use the bathroom or to give birth in some cases that they can actually push part of their reproductive system out of their body. So in this case, the animal's vagina, if it's severe enough, even their uterus can get pushed out of their vulva. And so common practice when that happens is to put everything back and then sew up the outside of the vulva so that they can't physically push it back out. And that gives them some time to heal. And I promise I picked the least terrifying picture I could put on this slide for you guys. For the nervous system, some common symptoms that indicate something is wrong with the nervous system are usually going to be kind of big, but there are also a couple that are a little bit more subtle. Obviously, seizures are a big one. Major behavior changes, increases in aggression or timidness can be indications of problems, especially rabies has a lot of neurological symptoms that can end up affecting the other systems and causing organs to shut down. But the first symptoms are really things like behavior changes, tilting heads, difficulty walking. By no means is rabies the only condition that causes that. There are lots of others, but those symptoms are going to tell you that something's going on with the nervous system. There might be some kind of damage, there might be some sort of inflammation, but there's definitely something going on there. That being said, things like difficulty walking could also obviously indicate an issue with the muscular or skeletal system. For the lymph nodes, we want to be feeling along the body and seeing if anything is swollen or anything's causing a reaction in that animal to indicate that like it's tender or sore. You can see on the image here, this is just for the dogs. These are pretty similar in most other animals. What the peripheral or like more external, more superficial lymph nodes are that you can actually feel for. So around kind of the back of the head, underneath the jaw, the armpit is a big one, front of the chest, inside of the back leg, and then back outside of the back leg. Those are all going to be places you want to feel for swelling. We know that the lymph system helps to kind of filter out pathogens in the body. So if something is swollen in the lymph nodes, that can indicate that that dog is fighting some sort of, or whatever animal, some kind of internal infection that's causing those lymph nodes to be overactive. In some cases, not all, but in some cases, that can also be an indication of maybe a cancer development because, again, the body's trying to fight that pervading infection. Ears, those of you who have taken horse companion animals, you know what to look for in ears because we wash and clean and check those out. But any discharge in the ear, I don't have it on the slide, but looking for like flecks of darker color that might indicate the presence of mites. Um, Smelling bad, like your dog's ears don't naturally just smell bad. That usually indicates there's some kind of infection going on, or if the animal is shaking their head too much. This is more common in any pets, which is, I think, mostly dogs and rabbits, that are going to have ears that are what we call floppy ears or that cover the ear holes. animals with upright or erect ears tend to have far fewer issues because there's more air circulating. Warm, damp places are perfect breeding grounds for bacteria. Um, and so it's a lot harder for those kinds of animals like Murphy when he came in, any of those dogs with floppy ears, they're much more likely to develop problems because there's just no air in there to kind of keep bacteria out. Eyes also discharge. Discharge is basically any like orifice, open hole into the body. Discharge is going to be an indication that there's an infection being fought or that there's an irritant in there. Might not even just be an infection, something in the eye, something in the mouth or nose. Discharge is the body's way of trying to get that out. If the animal's tearing up too much, again, kind of more tear discharge. And then if the animal seems to be having noticeable visual difficulties, um, looking for like a sheen over the eyes, any cloudiness, those are going to indicate a more usually chronic or long term problem. Not always something you can do a lot to fix, but is something you want to be mindful and have your vet check for so that you can take proper precautions. And then the mouth. Mouth is really important to look at. We, as pet owners, often overlook the importance of good oral hygiene and oral care, but it really is a way of extending the life of your animal. The mouth is a direct line to basically everything else in the body, and there are a lot of blood vessels that go from the mouth back to the heart pretty quickly. And so infections in the mouth can actually cause really big problems long term. But good oral hygiene, good like dental care also impacts your animal's ability to get nutrients effectively and efficiently. An animal like this dog down here that's got like very serious dental issues, that animal's not going to be able to eat right. They're not going to be able to get enough nutrients. That's going to cause health problems throughout the rest of the body. So it's really important to look for some of those things. Um, you want nice pink gums, good what we call capillary refill time. So if you press your finger down on the pinks of the gums, it should go white because it's not getting blood. And then you take your finger off, and if that doesn't pink up again in a couple of seconds, that's going to indicate a circulation issue. Um, Problems or causes of concern are if the gums are really red, if they're cyanotic, aka they're turning blue, or if they're super pale, or again, if they're not refilling with blood very quickly. Obviously, again, if you have a breed of dog that naturally has like dark skin, chows are a good example. I think I keep saying dog, but I mean like any animal. That's going to be a little different. They're not going to have pink membranes, but those are the kind of things you want to look for. You also want to look at any buildup on the teeth. If that's present all the time, that's going to be a concern because that tartar is going to wear down on the teeth over time and cause health. Okay, so the last thing I want to talk about is the importance of patient history because that's going to be your assignment tomorrow. Um, Veterinarians, doctors as a whole, see their patients like for a little bit of time, maybe half an hour to an hour every 6 months or a year, or maybe even less for some pets. That means that vets don't get to see what is normal in your animal, and they don't get to see if something has really changed significantly in the last, say, couple of weeks. So, vets are going to ask a series of what we call patient history questions to help establish what changes have happened and to help establish what's considered normal for your pet. So it just provides them a lot of extra information to determine, okay, yeah, this is weird. Maybe it's not a huge concern for most animals, but it's a significant change for yours. And it also helps them to get information to try and determine, what is wrong. I mentioned earlier that there are lots of health conditions that share lots of common symptoms. And so part of how we figure out what's the right answer or what's the right problem that's going on is looking at what has the owner noticed. Okay. Now, because animals can't advocate or speak for themselves, as an owner, it's that much more important to be paying attention to those things and answering those questions to the best of your ability. So, the vet's responsibility then is to ask those questions. And those questions need to be detailed and open ended. Good patient history questions are not a yes or a no. Yes or no doesn't give us a lot of information. Okay, if the vet asks, "Is your dog eating normally?" and you say no, What does that mean? Does it mean that they skipped their treats the last few days, or does it mean that they have been throwing up and not able to eat at all? So those patient history questions need to be big, they need to be open-ended. They need to allow the owner of that pet to give as many details as possible, because as the person doing the exam, we need those details. We need to know why this dog might suddenly be limping or favoring one side. We need to know if this dog has been in contact with other animals. We need to know if our horse was recently at a show and thus might have been looking at or working, not looking at, might have been seeing other animals, interacting with other animals. All of those things can increase their likelihood to get certain health problems. And so they need to know about that. Okay. So hopefully this goes through. You were able to get some information and get some notes. This is the end of your lesson for today. Make sure you've got your notes filled out. Tomorrow, what you're going to do is you're going to come back on Google Classroom. There's a discussion post. And what I want you to do is, using this information about patient history, using the information of some of the things that you should look for and notice in an animal, I want you to write out what are 10 patient history questions you would ask to learn more information about that animal's experiences, any potential health problems, etc. So, what are 10 open ended questions you might ask an owner to learn more about what might be wrong with their pet or their production?